Hey everybody, it's Ed O'Keefe, and welcome to another episode of America's Leading Dentist and the Miracle of Dental Implants. And today we're even going to talk about sleep apnea as well. It's pretty profound and amazing. I'm here with Dr. Dara Darabi. How are you, doctor?
I'm doing great, thank you.
Awesome. So you are actually the owner of a couple different dental practices. So I want to make sure I get this right. Apex Dental and Associates, or Dental Associates.
Dental Associates.
And then 413 Sleep Better, which is focused on helping people with sleep apnea. Am I saying that correctly?
Correct, yes, yeah.
Fantastic.
Yeah,
Right?
413 is our area code in
Oh.
the area we are. So we call it 413 Sleep Better.
Okay.
Yes.
Awesome. In Northampton, Massachusetts.
Yes.
That's amazing.
That's the main center of our office, especially our sleep. But we have multiple locations in other areas where we are, within 30 minutes of each office.
Yeah. So you do general dentistry, dental implants, and sleep apnea, correct?
Correct.
Awesome. So we're going to cover all this today. I love this topic. So, so if you're out there, especially let me talk about dental implants for a second. If you're out there and you're missing teeth, you have dentures, you have partials, your teeth are breaking down, maybe they've all fallen apart. And you've ever considered dental implants, well, today's the show. You're going to learn everything you need to know to make a great decision for you. And Dr. Dara Darabi is our main expert here. So, do you mind sharing a little bit about how you got into dentistry and now fast forward all the way to helping people restore their entire smile with dental implants?
I guess as we were talking a little bit before the show today, I mentioned that I was an immigrant to the United States over 40 years ago.
You don't even look over 40.
Yeah. Thank you. And I wanted to study physics, but there's so many changes in my life and so many incidents happen and that eventually I decided on dentistry. And I had the opportunity to work summer in the Tufts University. And that was the time that I wanted to kind of plan out to see what I wanted to do with my life. And I really enjoyed the interactions with patients. I enjoyed all the different things that you could do in dentistry. It had science, it had engineering, it had hands-on, and also the interaction with patients. Because I kind of put myself through school all those years in college and high school, working in a restaurant business, working in restaurants. And I loved that interaction. And I always tell my team members every day that I'm no different than what I was before. Yeah. We were doing service at that time for customers. Now we're doing a different kind of service for our patients.
That's right.
Yeah. So
pretty amazing.
Yeah.
Awesome. So now we're going to talk about two things today on the show. Number one is dental implants. Then number two is sleep apnea. So when you see patients coming into your practice and they're great candidates for dental implants and full arches, do you mind sharing with the audience what are the most common either symptoms or conditions that you see, and how do I know if I'm a candidate for dental implants?
A very good question. I think that there's a couple of categories of patients. There's some that already have dentures. They're kind of sick and tired of the dentures. They don't want to wear that denture. Or there are ones that they kind of know that they're going in that direction. Maybe they have had bad experiences and with losing teeth. And just a side story.
Oh my gosh, I love stories. Yeah, I want to hear all about them.
When we were in dental school, they always told us that this is what we had to tell patients, that the denture is not an alternative to your teeth, but an alternative to having nothing. So either you get nothing or you can get a denture.
So that was an old thought process.
That was an old thought process.
Yeah.
And as a student, we kind of accepted that.
That's what we do.
But we knew this doesn't make any sense, right? There's got to be a better way.
Yeah.
But it was not until, I don't know what, about 11 years ago, I had an opportunity to go and visit Mount Vernon, the home of George Washington, with my family. And when we were there, I think I was the only person that spent about, an hour and a half or 2 hours in the exhibit that they have about George Washington's dentures. George Washington lost his first tooth when he was 24 years old, last one at 57, and he was wearing dentures. And I think when he became president, he lost his last tooth. all along spending a fortune on his teeth. And this is what I see on patients. They come in, they tell me about the stories that I lost this tooth, I lost that tooth, and they have also spent a lot of money on their teeth. So it was then that I said, I got to find a way to do better for my patients, because I've heard that story. And the denture that George Washington got is really not any much better than what we do nowadays as a plain denture for the patient. Some of the technology has improved, but it is the same denture that you have to take in and out. Yeah. And it is a technology of 1700s. Now we're doing a podcast. A lot of people probably are watching this thing on their phone. We don't do things that we did in 1700s, right? Right. Everybody wants something different. And the implants and full arch cases that we do right now is a modern way of treating those patients who have no teeth at all, as long as they have good bone, which we can also help them out with. But the other categories, of course, is people that are either missing one tooth and they want that replaced, which is another thing that I always tell patients. The person that became edentulous, or what we call no tooth at all, they started by losing that first tooth. Yeah,
that's actually
the second one. Yeah. Then the third one. And then they get to the point that say, well, I may have like 4 or 5 teeth, but what can I do with it? There's nothing I can do. So let's just get those out. So the first thing to do is, if you're even missing one tooth, is to replace it. So you never get to that point.
Well, can we point out why that's so important?
Absolutely, because then one leads to two.
Yeah, but the bone, you get the immediate bone loss.
You get bone loss. You get teeth shifting. Bite becomes an issue. Then you might break a tooth because the bite is not the same thing. So it becomes a kind of downhill kind of situation for patients.
Collapsing cycle.
Absolutely.
Okay, cool. Well, I mean, the technology is advancing so much. So do you mind sharing like the options? And you kind of just went over like the one, obviously a single implant would be amazing. But you hear about like teeth in a day, you hear about all on X, all on 4, like it's a lot of stuff. So what are the options for patients as far as when they come to your office, you look at what types of different options are there for dental implants?
If we were talking about the single tooth or single one, or what we call 1 or 2 teeth missing, we have the technology in the office to do a 3D X-ray for the patients, because that tells us whether they have enough bone, whether we need to, do some bone grafting for them to get them to the level that they can get the implant. But we design everything on the computer virtually. Yeah. And we even, in some cases, make the guide that will tell us exactly, help us exactly where the location that we're going to place the implant for. So the surgery becomes very predictable, very easy for me as a surgeon, and very easy for the patients, because we can get the process down a lot faster. Yeah. Everything is done beforehand, basically, for the patients, for the surgery. In other cases where patients are they know that they have what we call terminal dentition, that they're going to lose their teeth. Once again, we do a 3D X-ray for the patient. So it tells us the quantity or the quality of the bone that they have. A lot of times when patients come in that situation, they have a lot of infections in their mouth. And that infection has been chronic. A lot of bone loss that has happened because of it. And they need a lot of that bone loss to be repaired before they're a good candidate for the implant. So by doing the first step probably is a very good examination of their teeth, what they have, and a good evaluation with a 3D X-ray. And then from there, depending on where they are in that journey, we kind of give them a treatment plan in terms of what would be the best option for them.
Yeah. What does it cost to come in for an exam? And
we usually have a free complimentary consultation for the patient. Yeah. But we don't really start anything until patients know what they're responsible for.
That's right.
What they need to pay and what their budget is.
Okay. Well, I think implants is I think there's 2 things. One, you just kind of answer, which is, am I a candidate? So some people rule themselves out just because of past thinking, where you can actually help restore bone and get people to become a candidate if they're not currently. Number 2 is, let's talk about money, because I think that's where, again, people equate implants with, those got to be expensive. So can you just share a little bit about how your office works with patients to find the plan and path that is going to help them get the the outcome they're looking for?
Quick answer to that, if anybody wants to know the numbers, you might be looking at anywhere from $4,000 to $6,000 for one single implant.
Yeah.
But again, that depends on where the patient started in their journey with that implant. Sometimes people come in, let's say one single tooth, they have lost that tooth for a long time. There's not enough bone. So we're not starting from zero, we're kind of starting from -5 sort of.
Yeah, that's
So
that's a good way of putting it. Yeah.
That may add a little bit to the treatment, or they may have a lot of infection that needs to be cleaned out. A lot of times people come in, they've heard of teeth in a day, or something similar, and they like to have everything done the same day. And I always ask them, it's like, do you want this thing the same day, or you want a success
For the rest of your life.
for the rest of your life? And you do not want to take a tooth out and place an implant in presence of infection. So a lot of that plays out. Also, patient's insurance, what their insurance covers, what the insurance doesn't cover. But we do have a great team that kind of handles that in my office. I do let them know what we can do for them to restore their mouth or their one single tooth, and the team will take care of that for them in terms of what their budget is. We have monthly payment plans, financing, certain 5 to 10% discount if somebody wants to pay up front or something like that. There are many options for patients to go, whether if it's a single implant or something like a full arch of their whole mouth.
That's right. That's right. I think that's where people, like, a lot of times the mistake people make is they stop themselves because they don't even know what options they're available. Like if I'm able to get $300 a month payments, but I get my teeth fully restored, I'm eating the foods I love once and again. The research now on just longevity and our ability to eat the foods and the nutrition due to implants and quality of life, I mean, you're paying a price by not having them. So that's amazing. You guys do guided surgery in your office?
I do.
Okay.
Almost most cases, especially a lot of the full arch cases, are guided because we can plan for it ahead of time.
Yeah.
We know exactly where to place the implant, and everything goes a lot easier, a lot smoother for the patients.
That's some. I mean, not all offices have guided surgery technology.
Yes.
So why did you decide to do that? Because it's a pretty unique value, or something pretty valuable for your patients out there.
For the patient, absolutely. Because a lot of times, especially when patients are absolutely have no teeth, what happens is kind of like trying to, sail in a cloudy night,
wow. Yeah.
right? You lose perspective. You don't know where everything is. Where's the sinus? Where's the nerve? Where's what? Well, guided surgery kind of eliminates that because we have already seen that in the scan, in a 3D scan from the patients.
Yeah.
And everything is fitted into the model of the patient's mouth and everything way before time. So still, you need to know what you're doing as a surgeon when you do this kind of stuff. But it eliminates a lot of the guessings and concerns during the surgery, makes it definitely easier for us, and predictably let us know exactly where we want to place the implants at proper locations for the patients. So
That's
better outcome for the patient.
Yeah, that's pretty amazing. Man, if I ever need dental implants, I think I'm going to call up Dr. Darabi here. That's pretty amazing. So the other question I want to ask you was, how painful are dental implants?
A very good question. I have a lot of patients who go through surgery from extraction all the way to the dental implants.
Yeah.
And what I found out is they actually think the implant placement and the implant surgery was a lot easier than extracting the teeth.
That's right.
Or any kind of
I've heard that. Yeah.
Yes.
Yeah. I heard there's very minimal like nerve endings in the bone. Is that the reason for that? Or
yeah, one of the things I tell patients all the time is that if we could get into the bone without having to make an incision in your gums, then we could just do this thing without anesthetic for patients.
Yeah.
So it is that easy. Yes, it makes it easier for patients doing the surgery because there are nerves that travel in the bone, but the bone itself doesn't have any nerve endings like your skin or your gums.
Yeah.
Yes.
Fantastic. So, okay, so if you're someone who's out there, this is talking directly to you regarding dental implants. you're missing teeth, you're sick of your dentures, you're wearing a bridge, you got failing teeth, you can go ahead and either click on a link below or give Dr. Darabi's office a call, book a free consult, come in there and find out what they can do for you. No risk, no obligation, and obviously super amazing. I love what they're doing over here. So let's segue real quick. Let's talk about 413 Sleep Better.
Yes.
Okay. So what's been amazing for me to see is how fast sleep apnea is starting to go mainstream, but then also what's so great is that you guys in a dental practice can help patients assess and get treatment on sleep apnea with mild to moderate cases, but also people that have already been diagnosed with sleep apnea. They tried the CPAP machines and it didn't work, or it didn't work. They were non-compliant. They didn't want to sleep with it.
Sure.
And I think one thing I was surprised about, Dr. Darabi, was I didn't realize dentists can actually help with sleep apnea. So can you share a little bit about how that works or
Sure.
why that is?
I have a lot of long stories, as you.
Oh, you do? No, I like stories make life fun, you know?
This all started actually right after I came out of dental school. I was lucky enough to get into a group of kind of forward-thinking dentists. At that time, it was a study club, International Association of Orthodontists, and we learned how to do orthodontic work. And I was doing braces and wires and everything for my patients. It was through that program and that study club that I learned that doing braces and orthodontic work is not just about straightening teeth. It's about developing the face to provide a better smile and a better face for the patients. And that comes a lot of times comes in by providing better airway for the patient. I mean, even at that time, which was about 17, 18 years ago, we were thinking airway, taking the tonsils out, for example, for young children, so they can breathe better, expanding the palate to provide better looking faces. And at that time, I remember one day I went to see one of my patients. She apologized to me about not being in her hygiene visit a week before. To make a long story short, she told me that her son, who was about, I think it was in his 30s, had died in the car while the girlfriend was driving him and her back from Pennsylvania, maybe Philadelphia, back to Massachusetts where we live.
You're kidding me.
He had sleep apnea.
So he just went to sleep.
He just went to sleep. By the time he got to, I remember that moment. I remember the chair. I remember where I was. So that kind of started me thinking. It's like, oh, this is really important.
Yes.
I started making my first appliance then. It's about 16, 17 years ago. The first 2-3 appliances we made for the patient to help them with sleep apnea. After we give them, many patients might not know, but after we give the appliance to the patient, we want them to have a sleep test again to make sure that the appliance is working, make sure it's doing what it's doing. And at the time, nobody wanted to go back because the insurance was not covering it to get a second sleep test, or they had to pay a lot of money out of pocket. And so once, I don't know, it was like about 4 years ago when I started kind of coming back to this, revisiting this, because I saw so many of my patients having that issue, and so many of their dental problems comes from not being able to breathe properly.
Right.
I realized that, hey, we do have the sleep machines now that patients can take home, and it made the process so much easier for the patient, so much easier. And so I jumped on there. It's like, we got to start providing this for the patients, and it is working, and it's a lot easier than it was 17, 18 years ago. And
that's right.
Even the physicians are more accepting right now, and there's more awareness of it right now. 17, 18 years ago, when I wanted to talk to a physician about it, they were very resistant because, like, you're a dentist, what are you talking about this for?
That's right.
No, they'll be fine. Or this kid will grow out of it. What if they have big tonsils or adenoids?
Yeah.
But there's a lot more awareness of it now, and now we're getting referrals from those physicians.
Yeah. Well, at first I was like, well, you mean a dentist is fixing it or helping people treat sleep apnea? And then it kind of actually makes more sense because for those who are watching, if you think about it, like who's in charge of your mouth? Your dentist. Who's looking in hundreds and thousands of miles a day? Like the dental offices are. So, but that doesn't mean every office treats it, by the way. So that's pretty incredible. Okay, so snoring is the most common thing people think. Snoring. Symptom, you probably have sleep apnea. The misconception, though, is that it only affects kind of middle-aged, heavy men, overweight men. Can you share some of the different symptoms of people that are walking into your door, and what are they experiencing at home or before they come to you and have a successful treatment?
It's a good question, because sometimes I feel like patients don't even know that what the symptoms that they're having is related to sleep issues.
Yeah.
Nowadays, everybody's life is busy. Parents running around with kids, and sports here and there, and everybody's explaining, "Well, I'm tired."
Yeah.
But I guess being tired and snoring might be one thing that people can understand.
Yeah.
They know that they have that problem. But routinely, we screen our patients for airway issues, and of course, with airway, we're talking about sleep apnea, and cardiovascular issues usually is the number one thing that we see from chronic, long-term, not treated sleep apnea.
In the form of high blood pressure?
Yeah, exactly. So usually, if I have a patient who is a male, over 50, and has marked down that they have high blood pressure. Side note about that, because sometimes I ask patients, "Do you have high blood pressure?" They say no, and then we see sometimes 2 or 3 medications for high blood
what are
pressure.
these for?
But it's like, what are you taking this for? Oh, well, it's I'm taking it for blood pressure. Well, you do have high blood pressure. You're taking medication for it, even though your blood pressure is lower.
Because they're thinking, because they're thinking I'm treating it. So
Right,
it's
exactly.
okay, got it. So
So
that's interesting.
Those
Interesting
three
take on it. Yeah.
right away, it tells us that.
Yeah.
But dentally, sometimes people even don't write those things on their medical history, or sometimes they forget about the medication. But dentally, what we see, there are many signs is people who have some signs of clenching and grinding, some type of acidic component to the erosion of their teeth, because people who have sleep apnea also have a high likelihood of having acid reflux issues. Sometimes people come in, they have a lot of crowns, caps on their teeth, a lot of broken teeth, and they're not wondering why every time they go to the dentist, something else broken. Well, that could be another indication.
Because they're grinding.
Right.
Yeah.
Sometimes you see patients with narrower arches, narrower palates, and that also can indicate narrower airway and nasal passages. So higher likelihood for that. Things with a different type of tissues in their mouth, evidence of mouth breathing. Sometimes you see that, and that could also cause problems with their periodontal issues, gum issues. The gums kind of get dry because they're mouth breathers, and they have more periodontal gum, recession because of that too.
Yeah, I just want to stop you there, because I was going to say, so if you're watching this right now and you're listening to all those symptoms, right? Everything from mouth breathing, narrowing of the arches, grinding, broken teeth, and go down that whole list, right? And then the most obvious are obviously snoring, or someone is telling you that you stop breathing at night. Please, because this is a life-threatening situation. It's not like, okay, it's not something that's going to fix itself. It's only going to get worse as time goes on. Have them book an appointment with Dr. Darabi at 413. Sleep better. This is why we do these interviews, because we need to get more people aware of their options and what actually is going on. So it's pretty incredible. Okay, so do you mind, I'm talking briefly about, so I imagine, do you guys do free consults on that as well?
We have complimentary consultation for patients for sleep apnea or implants that we talked about.
So that's amazing. And then with billing and insurance, or Medicaid, Medicare, what covers it, what doesn't? Mm-hmm. What are the options for patients as far as payment?
We do a complimentary benefit check for every single one of our patients who are interested in doing going through this treatment. But that again depends on their patient's insurance coverage. We work with many medical insurances, and we also a Medicare provider for our patients who have Medicare.
Yeah, it's amazing. Okay, cool. So you guys do the full, you'll take care of it. So what's super important about this is very, very important, is like right now, if you're somebody who's at home and you're not sleeping well, or your spouse or your partner or whoever you're sleeping with is having these issues, you're paying the price right now. You're already it's already costing you fatigue, energy, quality of life.
Accidents, possibly,
Yeah.
driving.
Yeah.
And, it's amazing sometimes. I don't know, but I'm trying to think like how many patients have high blood pressure and how much money they spend on
Oh.
blood pressure medication and what that high blood pressure does to the rest of the body,
That's right.
kidneys, and all that stuff. So
Yeah.
it is important to get the cost of doing nothing is actually could be.
Oh, it was way,
Costly.
way higher. Yeah.
Yeah.
I mean, I have a friend whose wife and kids are here. They're still on Earth. They're still alive, and he passed away in his mid-40s because of sleep apnea.
Mm.
And
It definitely can kill you.
yeah, it's pretty crazy, pretty crazy. Not to be depressing, folks. We're trying to actually inspire you to come on in here. Okay, cool. So you have a few different offices and locations. I kind of wanted you to explain to everybody how your different offices work and where they could book an appointment, or how they could reach out to the office.
For patients that are close or live in our area, we actually have some patients sometimes coming in from an hour and a half away for sleep because not that many providers in our area. But they can call any of our office.
We'll have links below the video, and then obviously, great.
Call us in. We start with a complimentary consultation for them, whether if it's for implants or sleep, and we give them the options, and we'll go from there.
Yeah, well, this has been a lot of fun. You're doing some really cool things. So thanks for being on the show.
Thank you.
It's great having you.
You.
So, hey, if you're out there and Dr. Darabi is speaking to you, you have no risk, no obligation, no pressure. You can click on the link below. I think we'll have a 60-second quiz for you to evaluate whether you're a candidate or not. And they always have special offers on the page. And give them a call. Otherwise, awesome having you watching this. Can't wait to see you soon, and have an amazing day, everybody. Thank you, doctor.
Thank you.